Mask requirements updated from January 2022. Because both the Delta and Omicron variants are shown to spread more easily, MDH, Minnesota Department of Health, recommends that everyone, both fully vaccinated and unvaccinated, wear a mask in the following situations: indoor businesses and public settings, and crowded outdoor settings in areas with substantial or high transmission. If you are immunocompromised or at an increased risk for severe disease from COVID-19, you should consider wearing a mask regardless of the level of transmission in your area. People who are at an increased risk for severe disease include older adults and those who have certain medical conditions. These include diabetes, people who are overweight or obesity, and heart conditions. Immunocompromised people, even if fully vaccinated, should talk with their healthcare providers for other specific recommendations. If you live or frequently interact with someone who is immunocompromised or not fully vaccinated or at an increased risk for severe disease from COVID-19, you should consider wearing a mask in indoor public or crowded outdoor settings regardless of the level of transmission in your area. Where you are in settings that could pose a high risk of COVID-19 spread or complications from COVID-19 infection, for example, schools, healthcare settings, homeless shelters, and correctional facilities. If you have symptoms of COVID-19, it is important to stay home and stay away from others. If you must go out, for example, to go to a medical appointment, you should wear a mask. If you have been close to someone with COVID-19, follow the recommendations for COVID-19 testing and close contacts to know what to do next. If you are not yet fully vaccinated or boosted with the third dose when due, stay home and stay away from others. You should wear a mask if others are around in your home. If you are fully vaccinated and boosted with the third dose when it was due, or if you have had COVID in the past 3 months, you should wear a mask around others for 10 days following any exposure. Fully vaccinated people may choose to wear a mask in any situation where it feels like it's needed, regardless of whether others are around them and if they are masked. Information specific to those who are not yet vaccinated. People who are not vaccinated, including children, are at a much higher risk of getting and spreading the virus that causes COVID-19 than those who are already fully vaccinated. In addition to the above recommendations for everyone, anyone who is not yet fully vaccinated, including children ages 2 and older, should continue to wear a well-fitted face mask in the following areas. This information is regardless of the COVID-19 transmission levels. Wear a mask in any indoor businesses or public settings, around people who are from other households other than your own, and in outdoor areas when social distancing cannot be maintained. When wearing a mask in these situations is impractical or impossible, for example, eating or drinking, or when presenting information in situations where it's necessary for your face to be visible, it is particularly important to maintain social distancing of at least 6 feet from others as much as it is possible. Laws in certain areas that may require face masking. Certain settings may have specific federal, state, and/or local legal requirements that would require the use of a face mask. The CDC requires face masks on buses, trains, trolleys, subways, ride shares, any maritime transportation, air travel, and other public transportation. Passengers and drivers must wear masks on school buses, including buses operated by public and private school systems. You are required to mask in healthcare settings. This includes long-term care, and this may be required by federal, state, or local regulatory authorities to require face masks in certain situations. Local authorities such as city, town, or county are permitted to establish mask requirements, and those requirements must be followed. Businesses and other entities can also set their own masking rules, and workers and customers may be legally required to follow any of these requirements. Please note that this is not an exhausted list of federal, state, or local requirements. Be sure that you understand your region and your industry's local requirements. Any businesses that are uncertain about applicable legal requirements should seek out legal advice. Reasonable accommodations. In certain circumstances, the use of masks may not be reasonable, and safe alternative accommodations should be considered. Businesses and other entities that choose to require masks should also consider disability exemptions. Businesses and other entities should be aware of the following. People who have certain disabilities, behavioral needs, or other health or mental health or developmental conditions may have difficulty wearing a mask or other face covering in a safe manner. People who have trouble breathing, are unconscious, or are unable to remove a mask without help should not wear a mask. Children under the age of 2 should not wear a mask. There are certain situations, for example, swimming or other activities that would either soak or submerge a face covering in water may make a mask unsafe. Minnesotans with disabilities have the right to live free from any discrimination. The Minnesota Human Rights Act prohibits disability discrimination in public places, employment settings, schools, and other areas. How do masks work? The virus that causes COVID-19 is thought to be mostly spread by respiratory droplets and fine particles released when people breathe, talk, cough, or sneeze. Wearing a well-fitted mask stops these droplets from spreading to others. This is extra important because around 40 to 50% of people with COVID-19 do not have symptoms but can still spread the virus. Wearing a mask does not mean people who are sick should be in public. Stay home if you are sick unless you need to leave to seek medical care. Wearing a mask and following other public health recommendations like staying 6 feet from others and washing your hands often. This can provide extra layers of protection against getting and spreading COVID-19. Different types of masks. Minnesota Department of Health recommends wearing a high-quality mask to help limit the spread of COVID-19, including other variants like Omicron. Examples of a high-quality mask include an N95 or KN95, which are both very good at blocking the droplets. If you do not have this type of mask, wear a mask with 2 or more layers of tightly woven fabric. You could also layer a disposable mask under a cloth mask to increase its effectiveness. That cloth mask should press the edges of the disposable face mask snugly against your face. Do not use face coverings made of thin, loosely woven, or single-layer fabric, such as certain types of masks, scarves, neck gaiters, or bandanas. They are not as effective in blocking the droplets that come out when speaking, coughing, or sneezing. If you choose to wear a scarf or a neck gaiter for warmth, also wear a mask underneath that. Any mask that incorporates a valve that is designed to facilitate easy exhaling, mesh masks, or masks with openings, holes, visible gaps in its design or material, or vents are not sufficient face coverings because they will allow droplets to be released from the mask. Look for masks with nose wires. They can improve fit and help with reducing gaps or holes. How to use a mask. First, wash your hands before putting on the mask as well as after taking it off. A mask must cover the nose and mouth completely and fit snugly against your face without any gaps. The mask should not be overly tight or restrictive, and it should feel comfortable enough to wear. For children ages 2 and older, find a mask that is made for children to help ensure the proper fit. Children under the age of 2 should not wear a mask. If you wear glasses, find a mask that fits closely over your nose or one that has a nose wire to limit any fogging within the glasses. Do not touch the mask when you are wearing it. If you often have to touch or adjust your mask, it means it does not fit you properly, and you may need to find a different mask or make other adjustments. Wash your mask after each time you wear it.